Welcome back on Market Headline. As rumor is buzzing about the good effect of Ivermectin in treating COVID-19, now the drug is trending and the price has been swollen. To cope with that, the government has set the ceiling price for drugs used in COVID-19 treatment through the issuance of Health Minister's decree.
There are currently 11 drugs that have potential to treat COVID-19. One of them is Ivermectin. However, many sellers are now selling Ivermectin in such high price, benefiting the momentum that people are now seeking the drug. Pharmacy stores across the country have reported a boom in sales of medications, and it has been sold on e-commerce sites. In a number of e-commerce sites, one strip contains of 10 tablets sold from 200,000 rupiah up to 600,000 rupiah. So it means that one tablet costs up to 60,000 rupiah. To cope with speculators, the government has signed the health minister decree on selling price of drugs used for COVID-19 treatment. The highest retail price for Ivermectin is 7,500 rupiah a tablet. This is the selling price for medicine sold at drugstores, pharmacies, hospitals, clinics, and healthcare facilities across Indonesia, as Health Minister Budi Gunadi Sadikin stated. IDX Channel reported.
COVID-19 pandemic has been a serious problem in Indonesia. The number of cases continues to grow, and it requires the administration's swift response in making policies related to COVID-19 handling. After issuing policies related to physical distancing and working at home, this time the government made a new decision regarding the drugs used. One of the latest is the Ivermectin. Therefore, in this infographic, I would like to explain further about the Ivermectin fever in Indonesia, starting from the facts about Ivermectin. In the first graphic, we can see the Ivermectin facts. One of them is potent drug legally requires a medical prescription used to treat parasitic infections. And the third fact is commonly used on animals. And the fourth one is have not passed clinical trials. However, the National Food and Drug Control Agency, or BPOM, has given the green light to conduct clinical trials on the use of anti-parasitic drug Ivermectin to treat COVID-19 patients. According to State-owned Enterprises Minister Erick Thohir, Indonesia is ready to produce up to 4.5 million tablets a month if the clinical trials show positive results. But what interesting about Indonesia is the tendency of panic buying. Since people are sounding about Ivermectin, pharmacies across the country are reporting a boom in sales of the medication, and it has been sold out on e-commerce sites. And as the demand goes higher, well, you know, the price goes higher as well. But to overcome that, the government has set the highest retail price for Ivermectin. And let's see the comparison in the next graphic. So in the second graphic, we can see the Ivermectin price. 12 milligram per bottle means there are 20 tablets. In the pharma, 123,000 rupiah, while the highest retail price has been set at 157,000 rupiah. Why Indopharma? Other than it is the producer, the company had obtained marketing permit granted by Food and Drug Administrator on June 20, 2021. The highest retail price setting is very useful because actual price is 123,000 rupiah, but many sellers put it in 350,000 rupiah. It makes Indonesian Consumer Foundation strongly criticized the phenomenon of the high selling price of Ivermectin as a therapeutic drug for COVID-19 patients. But so far, there is no sanction from government. And if we throw back a little bit, the drug's popularity comes after a number of high-profile Indonesian politicians championed its effectiveness in recent days, even though several global publications have shown Ivermectin's use for COVID-19 treatments, but current use is limited to clinical trials in accordance with World Health Organization's guidelines. And let's see Ivermectin use from the global point of view in the next graphic. So what they say about Ivermectin? WHO, or World Health Organization, say that Ivermectin only be used to treat COVID-19 within clinical trials. And US FDA, Ivermectin can be used on COVID-19 patient. That say Ivermectin, World Health Organization and US FDA. And other drug control authorities with good regulatory systems, such as the U.S. Food and Drug Administration, as well as European Medicines Agency, are also like-minded, as the current clinical trial data on Ivermectin as a COVID-19 drug is still inconclusive. But still, as the demand in Indonesia is very high, 8 hospitals in Indonesia are set to conduct clinical trials on Ivermectin as potential COVID-19 medication. Clinical trials are expected to be conducted over a period of 3 months. Last year, Ivermectin was not very popular as this day, but there were so-called potential COVID-19 medication, which were Efek and chloroquine. I will explain it to you through the next graphic. So we can see the Efek versus chloroquine in the fourth graphic. The first one is Efek. The first fact about Efek is treat RNA virus infection, approved by Japanese FDA and approved by US FDA as influenza drug. While chloroquine treat parasite infection, US FDA revoked emergency use of authorization, and chloroquine didn't pass clinical trial to treat COVID-19. The 2 drugs were chosen to treat COVID-19 because, according to several studies and clinical trial results in various countries, favipiravir and chloroquine were effective enough to overcome coronavirus infection, although to ensure it, more tests and more patients are needed. But the trend is decreasing. On the other hand, Indonesia lists Ivermectin as an antiparasitic prescription-only medicine. Doctors can prescribe Ivermectin to those who are in need of the drug but not a part of the clinical trial. Currently, about 8 hospitals will take part in the clinical trials to see the efficacy and safety of Ivermectin for COVID-19. And of course, we hope that Ivermectin will be a potential COVID-19 medication. And furthermore, we hope Indonesia will combat the pandemic as soon as possible. And stay tuned on us. Market Headline will be right back after this break.